Welcome to another session of Voices in Health. I'm your host, Dr. Barbara Kostick. Our topic today is healthy pregnancy. Being pregnant can be an exciting and wonderful time of happy expectations, but it can also be a time of uncertainty and apprehension. There's information readily available through books, the media, the internet, family, friends, and healthcare providers. This information can often be confusing and a bit overwhelming. Today, we're going to give you some simple, practical guidance so you can better understand the physical changes a pregnant woman is experiencing and how she can best take care of herself and her developing baby. My first guest is obstetrician and gynecologist, Dr. Savitha Krishnan. Welcome, Dr. Krishnan, to Voices in Health.
Thank you.
Tell us, when does a woman first know she's pregnant?
The first time a woman actually knows that she's pregnant is actually by missing their first menstrual cycle. And they usually take a home pregnancy test to confirm that they're pregnant and then call their obstetrician to schedule their first appointment. But some women actually don't even realize that they're pregnant by missing that first menstrual cycle. And they may be nauseous, they may have a little bit of bloating, they may feel fatigued, and then confirm that they have a pregnancy.
On getting the home pregnancy test, are those tests accurate that you buy in the drugstore?
They're actually very accurate. We have a lot of calls to our office to confirm that they're pregnant, either with a blood pregnancy test or a pregnancy test done through urine in our office. The patient may think that that's a more accurate evaluation. But the ones that are sold over the counter that patients take at home are almost as accurate as the ones that we offer in our office, so no need for those expensive tests.
What happens if your last period is a weird period and now you're feeling a little nauseous? Could you still be pregnant?
You could be pregnant, and it's actually highly recommended that you take a pregnancy test at home. And if your pregnancy test is normal or positive and your last menstrual period was not completely normal, it's actually very important to call the physician and be seen so that you and the physician can figure out your accurate dating so that everything in the pregnancy is actually based on dates, and a lot of the genetic testing is based on dates.
Yeah, let's go into that date testing and stuff. How does the doctor measure dates anyway?
So it's actually calculated from their last menstrual period, and that's probably because that's a very known date. But actually the time of conception is 2 weeks beyond your last menstrual period. But when you come in and discuss how many weeks pregnant you are, that will be calculated from your last menstrual period.
Is there a danger of going too long in a pregnancy?
So that's another concern. Usually we don't want patients going significantly beyond 41. Some physicians will use 42 weeks. And the reason for that is that the placenta that supplies most of the nutrients during the pregnancy is really made to last not more than 42 weeks. And there's an increased risk to the fetus if you carry a pregnancy beyond 42 weeks.
How else do you determine the dates for the baby?
So a lot of women that have irregular menstrual cycles, it's really important to get an ultrasound. An ultrasound during the first trimester of pregnancy, so from week 1 until week 12, is accurate up to 5 days of dating. So if your ultrasound shows that the fetus is significantly larger or smaller, we actually use the ultrasound dating as opposed to the last menstrual period.
Can you tell the sex of the infant at 12 weeks in?
It's a little too early at 12 weeks. There's a lot of educated guessing done at 12 to 14 weeks, but really the gender is identified somewhere between 14 and 18 weeks.
Now, most women, when they're pregnant in the first trimester, what's the #1 complaint they have?
Nausea.
Nausea. What do we do about that?
So nausea, essentially, the recommendation that I make to my patients is to eat small meals frequently. And what I really tell patients in terms of nausea is that hydration is the most important source for your fetus in terms of nutrition. So even if you're not able to eat solids, if you have your prenatal vitamin, or if you're not able to have your prenatal vitamin, just a Flintstone vitamin with some extra folic acid. And hydration is very important during the first 12 weeks.
And you just started mentioning about prenatal vites, so let's talk a little bit about them. Do you start those when you want to become pregnant, or do you start those when you're pregnant?
It's ideal if you see a doctor before you actually get pregnant, because you really want to have that folic acid on board for at least 30 days prior to conceiving. So most patients that are thinking of conceiving or in a childbearing age, I recommend that they take a multivitamin or a women's one-a-day multivitamin that has at least 400 micrograms of folic acid.
Yeah. And let's just explain why the folic acid is so important.
So folic acid is really important for spinal cord defects. And if you have a history of spinal cord defects, then even more folic acid is recommended. Almost everything nowadays, cereals, juices, are fortified with folic acid. But if you don't have the 400 micrograms of folic acid, you could definitely have an increased risk of spinal cord defects. And that's something that's very preventable, actually taking that multivitamin once a day in terms of spinal cord defects.
Is there anything else that you can prevent with taking a multivitamin or taking your prenatal vitamins in the first trimester? Let's limit it to the first 12 weeks.
A lot of women have anemia, and they start off the pregnancy anemic. So multivitamins or prenatal vitamins have extra iron in them that can help boost their or improve their anemia during that first trimester. And the second probably most common complaint outside of nausea is fatigue. And fatigue can actually be secondary to low blood counts or anemia. So improving your blood count by taking that extra iron actually helps them through that first trimester also.
Well, now that we know that we're pregnant 2 minutes after we're pregnant, what about weight gain?
So weight gain actually during the first trimester is not what one would normally think of in terms of weight gain in pregnancy. Usually I recommend about 1 pound a week in terms of weight gain outside of the first trimester. So during the first trimester, 3 to 5 pounds is on the average is what's recommended.
So in 12 weeks you can only gain 3 to 5 pounds, not 3 to 5 pounds in a weekend.
Correct. 3 to 5 pounds during the entire 12 weeks. So you're eating not for 2, you're just adding a little bit extra on during that first trimester.
Yeah. And so then what happens the second trimester?
So second trimester, so essentially after 12 to 14 weeks, all the organs have started developing, and all of your organ systems are forming between week 14 and week 24 to 26.
So that means your lungs are forming, and your liver, and the heart, like you said, has already been beating for about a month now.
Yes.
And I think, don't we start feeling something called quickening or something like that in...
So quickening essentially is when the mom perceives movement. And that's usually with the first pregnancy, usually around 20 to 22 weeks. Moms feel that a lot earlier with the second pregnancy, probably because the muscle of the uterus is a little bit thinner and they have the expectation of fetal movement a little earlier. But usually with the first pregnancy around 20 to 22 weeks. So if an infant was born at 24 to 26 weeks, all the organ systems would be essentially there, but not completely matured. So between the 24th week, the third trimester, and 36 to 37 weeks when the infant is born, that's when the organ systems are eventually maturing.
What about the mom? How is she emotionally during this time?
So emotionally during the first trimester, I think because of the fatigue, women tend to be tired during the first trimester. And then I think they also tend to be tired because of the nausea and persistence of nausea. Sleeping disorders, I don't notice as much during the first trimester, and I notice them more during the second and third trimester. And that sometimes impacts mood because of lack of sleep or interrupted sleep at night. You know, the other thing actually that goes on in the second and third trimester is that women are more uncomfortable secondary to reflux. In terms of acidity refluxing up into the esophagus, and when there's supine laying down, that tends to be even more pronounced of the reflux. And then also,
especially if you have it's the 7-pound weight right there.
Right, and the stomach empties slower during pregnancy, increasing reflux. And also what happens is that towards the end of the pregnancy is that the bladder capacity decreases, so women are running to the restroom back, in the middle of the night, and that interrupts sleep, causing more irritability during the day. So there's a lot of factors that impact mood during pregnancy.
Yes, a lot of physical factors as well as mental factors too, probably getting ready for the baby.
Yeah, and I noticed that also there's a lot of apprehension in terms of that can affect mood also. And I feel the more education that patients have through resources that are available to them, their apprehension decreases and their mood improves.
Tell me, what are some of the myths or misconceptions that people come and talk and mention to you?
So one of the largest misconceptions is eating for 2 in pregnancy, and that there is a tremendous amount of weight gain in the early part of pregnancy. So eating for 2 is a common myth, and the other really common myth is not exercising during the first trimester of pregnancy. The myth is that exercise during the first trimester of pregnancy will cause a miscarriage. And the fact really is that the healthier you are during the entire pregnancy, the healthier your pregnancy outcome is going to be.
Well, you know, exercise is also supposed to make the immune system healthier, and I thought pregnant women have a changed immune system, don't they?
So pregnant women typically have a suppressed immune system. You'll see that actually in terms of being immune suppressed. So a lot of second-time moms have a first child that goes to daycare or goes to school. They bring home a lot of illnesses. So I tell patients just be really careful with hand hygiene, be very careful with illnesses that are coming home, because viral illnesses tend to last longer and tend to be more severe. Being immune suppressed makes vaccinations during pregnancy very important. I try to stress the importance of the flu, you know, because a lot of the morbidity and mortality has unfortunately been in pregnant women with the flu, because of the changing physiologic factors, we're not able to actually help these women that have the flu significantly, and they're immune compromised, so they're not able to fight the flu as well.
And then, well, let's talk about third trimester, because we haven't talked too much about that. Tell us some of the problems that go on there.
So a lot of the problems in the third trimester is the increasing pressure of the pregnancy. The pressure issues tend to be more with the second pregnancy, because with the second pregnancy, all the ligaments are stretched out from the first pregnancy, and the rectus muscles don't support the pregnancy as well. So the pregnancy, you tend to carry a little bit lower. The muscular support also tends to be more pronounced in women that aren't as physically active, because they have less muscular support for their pregnancies. But I find that exercising and yoga and improving flexibility and balance helps with those aches and pains during the second pregnancy, the third trimester. The other very common complaint is running to the bathroom for decreased capacity of the bladder. Because you can imagine the uterus sits here and the bladder sits right in front of the uterus. So as that fetus is growing and as the infant is growing in the uterus, the capacity of the bladder decreases.
What about sexual activity?
Sexual activity is actually safe through the entire pregnancy. The only contraindication to sexual activity is placenta previa. So that's where the placenta is essentially covering the cervix, because sexual activity can cause bleeding with the placenta previa.
Yeah, because the placenta can attach anywhere on the uterine wall, and sometimes, depending on how it just bounces around, it attaches low down in the uterine wall near where that's going to dilate up.
Correct.
And that's called the cervix. The cervix is actually part of the uterus.
Right.
Yeah.
Right. And usually people will get an idea of the placental location at about 18 to 20 weeks when they have their 20-week ultrasound to determine the anatomy of the baby and the location of the placenta. And the other contraindication is preterm labor, because sexual intercourse can actually cause the uterus to contract and can worsen preterm labor for patients.
Well, what's preterm labor?
So preterm labor is actually uterine contractions that cause the cervix, or the opening of the uterus, to start dilating.
And to thin out.
And to thin out.
The muscle to thin out.
So to thin as well as to dilate. And usually women will have painless contractions through the pregnancy, which is very normal. So women can have up to 4 to 6 painless contractions in an hour, not causing any harm to the pregnancy at all. But if they feel that their contractions are becoming painful or becoming more constant, then they should see a physician. The physician will do an exam and see whether or not the opening of the uterus or the cervix is responding to these contractions. And that's the definition of preterm labor.
Well, talking about baby movement again, you feel the quickening early on, and then the baby moves throughout the pregnancy. Do you monitor that at all, movement of the baby?
So your healthiest outcome predictor is mom's perception of baby's movements.
Oh.
So we've looked at all kinds of things, ultrasounds, non-stress tests, coming into the doctor to listen to the baby, and none of them seem to be as accurate as mom's perception of baby's movements. So I always advise patients that you have to feel at least 10 movements twice a day within a 2-hour period after 28 weeks of pregnancy. And if you feel like your baby's not moving as well as you normally would expect your baby to move, come on in and see your doc and have some reassurance. But mom's perception is the best outcome predictor.
Wow. And then what about mother if she has some health problems? Any particular things to worry about there?
Chronic hypertension is a significant health problem that can worsen during pregnancy and can cause problems during the pregnancy and the outcome. Diabetes is another significant concern for pregnant women. You know, being significantly overweight can increase your risk during the pregnancy for a lot of complications during the pregnancy. But those are the main 3.
When we come back, we're going to take a close look at the do's and don'ts of nutrition during pregnancy.
Sometimes the littlest people can get into the biggest trouble. That's when you call the Poison Control Center hotline. For poison emergencies or just questions, get expert help day or night. Call 1-800-222-1222.
If you think it might be poison and you don't know what to do, call 1-800-222-1222.
You were not created in 2 dimensions. You are a complex construction of muscle and bone, blood vessels and synapses. Seeing your inner workings takes some equally sophisticated technology. That's why at Washington Hospital Outpatient Imaging Center, we've invested in the most advanced digital imaging equipment so we can diagnose you quickly and accurately. We see the whole you to treat the whole you. Go to WHHS.com to learn more.
Joining us now is dietitian and clinical manager of Washington Hospital's Food and Nutrition Services, Kimberlee Alvari. Thank you and welcome for joining us, Kimberlee.
Thank you. I'm really excited actually to be here today because nutrition is important throughout the entire life cycle, but probably no more important time than during pregnancy, because not just one person, but 2 people are depending on the nutrition at that time. They're not eating for 2, like Dr. Krishna said, but they are depending on the nutrition.
So when do you think a pregnant woman should consult a dietitian?
The sooner the better. I think that oftentimes what happens is they don't know until a little bit later that they're pregnant, but the sooner the better. If they're thinking about getting pregnant, they can always visit mypyramid.gov and go on there and start looking at the meal planning for pregnancy and nutrients that they need. And I think there's no better time than as soon as you think you're going to get pregnant, or the minute that you are, that you start looking at what you're eating.
Okay. And then a lot of nutrition, there's a lot of books out on nutrition and pregnancy in terms of recommendations during that early part of pregnancy.
Well, the March of Dimes has a lot of resources too. I mean, you talked about the internet in the opening, but the March of Dimes has a lot of good literature, but mypyramid.gov is really just, you can put in specialized program just for yourself based on your age, your height, your pre-pregnancy weight if you know you're pregnant, your activity level, and you can put that information into the pyramid and you can get specific guidelines personalized pretty much for you. So you haven't really had to go out and see anybody, but you get a lot of stuff brought right to you in terms of nutrition.
Well, how many calories should the average woman have a day?
Well, it is a myth, like she said. It's a perfect time to think you're eating for more than 1 because you want to have it to be a license to overeat. And when I first heard that the cost of it calorically over a pregnancy was about 77,000 calories, I thought this is the time. But the reality is when you break it down, because the pregnancy goes for a while, it ends up being about 300 calories a day. So that's equivalent to a Snickers bar, or about 3 cups of 1% milk. Obviously, there's better nutrition in the milk than the Snickers bar, so you do have to choose the nutrients.
I'd take the Snickers bar.
Yeah.
But that 300 calories, you don't need that in the first trimester. And maybe you need a little more in the later trimesters? Or?
It pretty much is the average. They just put that out as an average over the pregnancy because you do need more, and I think the calorie needs are actually a little bit higher than 300 as you get along in your pregnancy. But when you average it out, it's just a good round number to stick with, and women can start to learn what kinds of healthy snacks are 300 great ideas. A half a turkey sandwich and a large banana, a piece of toast with a tablespoon of peanut butter and a glass of milk. Those are much better ideas, of course, than the Snickers bar because much more nutrition in there for that baby and the mom.
Now, Kimberlee, when you look at a plate of food, you see, okay, that's good, that's bad, divided up into vegetable, protein sections and things.
I think I do. I think that's just the way a dietitian mind thinks, but I think it's pretty easy to teach people how to look at their plates just visually to be able to look at what they're looking on there. The protein's probably about a quarter of that plate. A half of it's going to be your vegetables and fruits and a little portion for starch. So it's a pretty easy tool. You don't have to be measuring everything or doing a lot of extra work just to visually know what you're eating is good for you.
Well, with the American diet, do women come in with nutritional deficiencies when they're pregnant?
Not so much, except for that what Dr. Krishnan mentioned is that even with the perfect diet, the best planning, because women are very motivated if they know they're pregnant to do well with their diet. But I think that it's very difficult sometimes with a perfect diet to even get enough iron or folate. The folate needs to, go up 50%, 400 micrograms before pregnancy and 600, sorry.
During pregnancy.
During pregnancy. So it's difficult to meet those needs as well as the iron.
So what are the sources of folate in the diet if we want to do it in the diet and not in a pill?
Great sources of folate are in orange juice, green leafy vegetables. Spinach is also in broccoli. It's also found in fortified cereals, and that's probably a great source. If you can get a fortified cereal with folate, then you're going to have a great source every day, and that's probably what I would recommend considering. You can also get it in beans. You can get it in pinto beans, black beans, and like a white bean. You can also get some folate.
So irregardless of the folic acid nutritional requirements, I usually recommend patients to take a prenatal vitamin with folic acid in addition to their nutritional supplementation.
Absolutely, and I would agree with that because it is difficult to meet with the perfect diet.
Yeah.
Well, what about herbals?
Herbal supplementation in general, I would talk to your doctor about that before you do that, because I don't know specifically what the mom might be trying to use it for or doing. So they may need a little education there in terms of the safety and the use.
Well, Dr. Krishnan, what kind of herbals have you seen in your practice?
So I've seen a lot of chamomile use for insomnia in terms of teas that may have chamomile in them. And relatively, I usually recommend to patients that in moderation, most of these herbal supplements are safe. The problem with the herbal medications is, unlike our medications that we have extensive FDA testing or federal drug testing for the safety and side effects, we don't have that with herbal medications. So that's the only caveat that I add in for patients, in terms of that there is some doubt as to safety of these medications long term. But a lot of these herbal remedies or herbal medications have been around for a long time.
I think it's important, though, to remember to keep back to the basics, that some of these supplements may be looking for an answer, but the simple basics is, as she spoke of earlier, of having a grazing principle or small frequent meals, keeping yourself hydrated, because once you get out of that, get into a cycle of nausea, sometimes it's hard to come out of it just by the natural process that's going on in the body. So you really want to get something in. For example, we tell patients sometimes, if you have a problem, keep crackers by your bedside. Before you get up in the morning, put a cracker with a little saltine cracker by your bedside, kind of settle your stomach before you even get out, because you've just been on a long fast throughout the night, and sometimes just the process of not breaking that cycle of no food creates more nausea.
Are there certain foods that we should avoid during pregnancy?
Yeah, I think actually that's a good point, because I think what we spend a lot of time talking about what to eat, and probably just as important or to highlight is things that you might want to be very sure that you stay away from. Those things would be fish that are high in mercury. Those tend to be shark, swordfish, tilefish, and king mackerel. All fish that are higher in mercury that can affect the neurological development of a baby. You want to just stay away from those.
I heard the bigger the fish, the higher the levels.
Those are all big fish.
Those are all big fish.
Those are all big fish. So the big
What
fish.
about deli meats?
Well, deli meats is another topic in terms of the bacteria Listeria. Listeria causes listeriosis, an infection in the mom. It does come from deli meats or hot dogs. It also comes from unpasteurized dairy products. So soft cheeses like brie and feta and camembert, those types of cheeses can harbor that bacteria Listeria and then result in listeriosis, and that can be really harmful for the baby. It can actually result in miscarriages, preterm labor, and death.
Stillborn.
In very small cases, but it's still significant to be very careful about, not having those soft cheeses that are or dairy products that are unpasteurized. In terms of listeria, I think it's pretty common to have, because I think they said the average home refrigerator, 70% of home refrigerators have listeria in them.
Oh, really?
So actually keep making sure if you've gotten spills and things, wipe them down. Make sure you separate your raw meats and things and dairy, from your raw vegetables, and keep things separated in your refrigerator. Keep it clean. So it's really important.
I think you should have someone else do that for you while you're pregnant, because you wouldn't want to be exposed to it.
Yeah.
Yeah.
You could have somebody do that for you. I think that's a great idea.
So we've got to keep our refrigerators clean. What about prep areas and things?
For the same reason, foodborne illnesses, can be common, because she talked about the immune system actually being a little bit more compromised during the pregnancy. So they want to be careful with potential foodborne illness, and that could come from, just having, not washed your hands before handling food or after handling food. Maybe you already have a child. She talks about them already having children. Maybe you've changed a diaper and then you're running off to do something. But keep those hands clean. Use separate cutting boards for raw meats, fresh fruits and vegetables in your breads. Wash them often. Keep hot foods hot, cold foods cold, and keep things cleaned up. So.
Because a lot of problems with these GI illnesses is a pregnant patient can lose a lot of fluid very fast, whether it be through loose stools or through throwing up. And dehydration can cause a lot of issues with the pregnancy also.
And I would just add to the foods that potentially could cause listeriosis, and we mentioned all the mercury foods, but I would also add to stay away from raw fish in general, sushi. Stay away from, uncooked eggs or raw eggs that have been used in making a hollandaise sauce or a Caesar dressing.
Chocolate mousse.
Yeah, anything where they haven't had the opportunity to be cooked, and then of course sprouts. So it's very difficult to wash a sprout, or to rinse them very well. So if you're going to have them, if they're cooked or put into a food product, it's different than just having the raw sprout itself.
What about caffeine? My favorite, outside of chocolate.
Well, caffeine, there's some research that possibly it could affect the baby in terms of having low birth weight. We do know that it's a mild diuretic and a little bit of a stimulant, and moms don't really necessarily need that. So it's a little bit of a mixed picture in terms of caffeine, but really the recommendation is, keep it moderate on the intake. And what's moderation? Moderation, 200, 300 milligrams a day. It depends on where you're getting that caffeine from, too. A specialty coffee shop might be enough coffee for the whole day.
Dr. Krishnan, how do you advise your patients about caffeine then?
So I usually tell patients that up to 1 to 2 cups of coffee a day is fine during the pregnancy. Most studies suggest that it doesn't increase the risk of miscarriage if kept at moderation. It does show that over 300 milligrams of caffeine can cause problems with insomnia for a pregnant patient and issues with lactation in terms of the infant having insomnia and not being able to latch on well in terms of breastfeeding. But usually if women keep the caffeine intake to less than 200 milligrams, outcome is healthy for the pregnancy.
I think they need to remember too, we often think of coffee as the source of caffeine, but caffeine can come from, not that you would want in a pregnant person's diet, colas and things like that. They're going to be a source of caffeine, as well as teas, chocolates. Some medications actually have caffeine into them too, so they should be careful to add everything up when they're looking at what they take in a day.
Well, Dr. Krishnan, you said there's a big problem with gestational diabetics, and we need to touch on that with nutrition too. First, why don't we explain what gestational diabetes is?
So gestational diabetes is essentially diabetes that is a result of the pregnancy. So during the pregnancy, what happens is that the body actually produces a peptide that causes insulin resistance. So if you're kind of on the borderline of developing diabetes lifelong, more than likely the pregnancy will tip you over and you'll become a gestational diabetic. So usually we screen between 24 and 28 weeks of pregnancy for gestational diabetes. Pre-existing diabetes definitely signifies a much higher risk pregnancy than gestational diabetes, but gestational diabetes is the more common of the two.
And speaking about, mothers who have medical illnesses, that affects their diet too.
It does, and that would definitely be a situation where, like Dr. Krishnan mentioned earlier, that they would need to see a registered dietitian to discuss those meal plans, because they are very therapeutic. They're designed to do specific things, keep the blood sugar low, particularly with gestational diabetics or high blood sugar. Everything is very therapeutic or prescriptive in nature in terms of how they eat, what they eat. Do they have milk at breakfast? Do they not? What kind of snacks they have. So that and any other medical condition, they should probably see a dietitian.
But what about other people on special diets, like a gluten-free diet or a vegan diet? What about those?
Oh, those are all special dietitian trips too, trips to the dietitian for that. And it's not as simple as just looking for something you're allergic to, because there's hidden sources of it. For example, malt barley has gluten in it, but it's in all foods. And so, people will read a label and say, I can have, Rice Krispies because it's a rice. It doesn't have gluten in it, but it actually is flavored with malt barley, so they can't have Rice Krispies. So it gets very complicated for them, and they really need to seek out specific attention to meet their pregnancy needs and to keep their bodies healthy.
Okay, we've talked enough about things to avoid. What are the things we need to take?
Well, I think we hit on many of them. Fish with omega-3s in them, or DHA, is going to be a great source to help brain development in the eyes. Salmon, pollock, tilapia, shrimp, tuna, light tuna, white tuna are going to be good sources. You want to be careful with the albacore tuna or tuna steaks and keep that limited down to no more than 6 ounces a week. But all the other fish that are acceptable and not high in mercury that I mentioned, you can have up to 12 ounces a week. So that equivalent to about 2 or 3 servings of fish. And it's really helpful in terms of getting those omega-3 fatty acids. Some kind of studies, not total proof on it, have shown that mothers in their last trimester, if they're getting those omega-3s, having salmon and having those things, that their babies have more regular and sound sleeping patterns. And so what mom doesn't want that?
A
I
lot
think
of,
that would be good.
a lot of prenatal vitamins now actually have the omega-3 included in the prenatal vitamin.
Absolutely, and I think the average intake is around 50 milligrams a day, and I think what we're talking about is more like 200, 250, something like that.
A lot of women
Researchers.
have trouble with constipation too, and hemorrhoids in the last trimester. How do you change their diet for that?
Lots of fruits and vegetables, and probably looking at a whole grain cereal, some whole grains in the morning, a bran cereal or something like that. And I think what women mostly forget about is adequate fluid and hydration, that they're not, you need to drink, 8 to 12 cups of fluid throughout the day. And when I teach women in the pregnancy class, I usually tell them, measure that amount out or put it in a bottle and carry it around through the day. Now, obviously, your fluids can come from everything that you're drinking, but at least you have a visual and a concept of what you need to do. Most women, if they're busy or still working or whatever, will go through a day, and most people do. They're not drinking that much, and all of a sudden they realize at the end of the day, I didn't get much fluid today. So they start drinking, but then they kind of back off because they're going, I'm getting ready to go to bed, and I don't want to get up and have to use the restroom. Like you said, becomes very common because then I'm going to lose sleep. So just making sure activity, of course, fruits, vegetables, whole grains, and lots of fluids.
And then source of iron, they talk about use an iron skillet for your source of iron. Is that true?
Absolutely, and actually
Really?
years ago, molasses actually is a source of iron, but it's not because it's naturally found in molasses, it's because it used to run through iron piping, and so the molasses would pick up iron out of the pipes. You can do the same thing if you cook in cast iron skillets. You put, whatever you're cooking there, it's going to leach the iron out of the pot and give you a little iron in your diet.
I think what patients don't realize is as they go through the pregnancy, they're actually producing more blood volume than they do blood cells.
Absolutely.
So they actually have a dilutional anemia, and almost probably about 80 to 90% of our patients require an iron supplement through the pregnancy. And then at the time of delivery, they lose about 300 to 400 cc's of blood. So if they're significantly anemic at the time of the delivery, they're really compromised after the delivery versus if they started off with a relatively normal blood count.
Right, and I think that's why you need to also remember, though, and I think why those two, the iron and the folate, become very necessary in pregnancy, because the folate's involved in making red blood cells as well. And so when you have that demand going on, you've got the folate for the neural tube defects, as you spoke, but you also have to keep up with the blood volume that you need to develop, and that folate is involved with that iron making those red blood cells. So it becomes very significant for pregnant women. And actually a good food, a superfood during pregnancy, is actually if you can get a fortified orange juice, because you can get a little calcium in it. It'll be a great source of folate, about 15% of your folate needs. And if, depending on the brand you buy, you might get a little kick of some vitamin D in there as well. So great superfood for women. Don't want to drink a lot of juice, and you don't want to have added sugar, maybe a serving a day, but that is a nice choice for a superfood.
Let's talk about the reduced fat foods, because we've gained weight in our pregnancy, and now we want to watch it. So I'm going to just switch to my reduced fat foods. Is that going to be a problem for me?
You know what, I wouldn't look at having any kind of dieting or reduced fat foods. Just eat the whole foods during pregnancy, unless your weight gain during the pregnancy has been shown not to be non-nutritional in nature, meaning that it isn't due to your retaining fluid or you have had a lot of weight gain with the high blood sugars with pregnancy. And if it's determined to be your diet, you want to probably look at choices that you're making. If you're drinking whole milk, a 2% or a 1% milk is going to be fine, but specifically searching out non-fat foods and doing that. I don't think that's a time specifically to do that unless there's a shown problem that you're having in terms of your consumption of what you're selecting in your diet.
Well, we'll be right back with an in-depth look at the value and safety of exercise for pregnant women.
Poor nutrition today will increase Sarah's chances of anemia, add to her healthcare costs, sick days, even stunt her ability to learn. And the thing is, Sarah's not even born yet. Get proper nutrition before it's too late. Call or visit WIC. WIC provides nutrition information, healthcare referrals, even food. Your child has you, and you have WIC.
Every woman is unique. At the Washington Women's Center, we take a unique approach to your health. We offer a comfortable, supportive environment, state-of-the-art technology, health screenings and resources, and we're the first center in the Bay Area to be named a nationally accredited breast center. We're more than a health provider. We're your health partner. Call to schedule an appointment.
Please welcome my next guest, Gail Fiock. Gail is a registered nurse, a prenatal fitness instructor, and a lactation consultant with Washington Hospital. Thank you so much for joining us, Gail.
Oh, you bet. Thank you for having me.
What are some of the myths and misconceptions about exercise during pregnancy?
One of the biggest myths is hearing that moms need to keep their heart rate below 140 beats per minute. We still see that in books and you hear that on the internet, but that really isn't the best way to decide whether mom is doing fine or not.
Or if the baby is okay.
Or that the baby is okay, exactly. And doctors have changed that recommendation, so they've taken the 140 beats per minute out of the equation.
Dr. Krishnan, do you worry about a fast heart rate in women exercising?
I don't, and actually the resting maternal heart rate is higher in pregnancy. So usually it's around 60 to 70 in a fit woman, and it's around 80 to 90 in a mom that's pregnant. So I don't even ask our pregnant patients to actually take their heart rate while they're exercising. I usually use their perceived exertion levels. So if they're able to carry on a conversation while they're exercising, they can continue to exercise.
Well, how good is exercise for you? Since you're all telling me to do it, how good is it for the pregnant mom and the fetus?
It's wonderful. It makes moms feel better. It can minimize a lot of the discomforts during pregnancy. It helps her mood. It helps her metabolize her sugar a lot better. So there's so many benefits for mom and for baby.
What have you seen in your practice and your patients, the ones that exercise versus the ones that don't?
So the ones that exercise during pregnancy do a lot better during the pregnancy in terms of aches and pains. Their mood is significantly better during the pregnancy, I think because of the effect of exercise. And also during labor and actually the pushing phase of labor, fit patients or patients that exercise through the pregnancy do significantly better than patients that are not as physically fit in terms of forceps deliveries, vacuum deliveries, and C-section rates. So I encourage my patients to exercise from the moment of conception all the way up until delivery.
So you're telling us that labor and delivery, labor is work, and you better be in shape for it, huh?
It is like running a marathon. So, you know, if you are out of shape for running a marathon, you will not be able to push effectively. And the pushing phase is at the very end of your labor phase.
I always tell moms they're in training for the most physical event of their life. And so even though we don't want them to have pain, we say, you know, no pain, no gain isn't a good idea for anybody, but especially during pregnancy. It is good to work at a level that's comfortable for them and to work hard enough that they're really getting a good workout.
Well, let's talk about that. What kinds of exercises should we do?
Walking is fabulous for someone who hasn't been very active. Walking is a great place to start. Walking around your block, walking around the park, using that talk test is a great way to let you know whether you're working too hard or not working hard enough. So if
Using what test?
The talk test. So if I'm walking around like Elizabeth with you and I'm getting winded and I can't catch my breath, and that's a message to me that I need to slow down, maybe just stand for a little bit or take a rest on the bench and wait until my breathing is more controlled, and then I can continue walking the other half of the lake.
So walking is cardio, right?
Cardio.
So what other kinds of exercises do you do besides cardio?
Swimming is wonderful. That's another cardio exercise, but stretching, some light resistance training or lightweight training can be fine.
So I think in a lot of these patients that have not been physically fit prior to the pregnancy, swimming is great because it kind of gives you the perception that you're not pregnant because the water supports the weight of the pregnancy.
Oh, absolutely.
And then with increased weight in joint issues, the water significantly improves their issues of joint pain after the swimming episode or aerobics. Water aerobics is great also.
And what about the water? Should it be hot, cold? Should it be, you know, what kind of temperatures should you be in when you're doing your swimming?
So it should be comfortably warm, but just like during pregnancy, we don't want, moms can't cool the baby off, so we wouldn't want a hot tub. Hot tubs aren't considered safe during pregnancy.
So I guess that would mean we don't take saunas or steam baths either during pregnancy.
So we don't take saunas or steam baths, and the reason is you don't want to submerge your pregnant abdomen with the fetus in the abdomen into an elevated temperature because you can't cool off. But you know, I frequently get questions about hot showers, and there's very limited contact of the hot water with the pregnant abdomen, not enough to elevate the temperature surrounding the fetus to cause any significant harm. But you would have to submerge your abdomen in warm water for a significant period of time to heat up the muscle of the uterus, the amniotic fluid, and then to actually affect the fetus.
What about the couch potatoes? How are we going to help them?
They should go slow. They should really start just with what's feeling comfortable for them, and just maybe some gentle stretching. Yoga is a wonderful thing for moms maybe who weren't really active before pregnancy. They can do some gentle stretching and move real slowly and listen to their bodies.
Work on their core muscles.
The core muscles are primary, and those are the muscles that we use to push the baby out. The uterus does its part, but we also need our abdominal musculature to do the work of labor and birth. So we do a lot of core training. We do a lot of balance exercise and balance and looking at your new center of gravity, because it's totally off. As the baby grows, moms tend to have a sway back, and that can lead to a lot of the back pain that moms experience. So a lot of what we do is to try to help them identify their center of balance, and to do a pelvic tilt to support their belly so they're not having that sway back and hurting their back muscles. That's one of the most common complaints of pregnancy, is low back pain. But also you can have shoulder pain if they tend to be hunched over, because their breasts are also growing. So they really kind of, their whole body changes.
Dr. Krishnan, sometimes we're told to write a pregnancy exercise prescription. Does a patient's or the pregnant mom's medical history affect what you would write for that exercise program?
The medical history is significant if there's an issue with blood pressure and chronic hypertension. So a lot of these women, and for multiple gestations, so with chronic hypertension, starting with that, as they go through the pregnancy, in the second trimester, the blood pressure usually goes down, but in the third trimester, we usually see an elevation in the blood pressure. And a lot of these patients with chronic hypertension, unfortunately, need to be on bed rest towards the end of the pregnancy to keep their blood pressure well controlled. But outside of that, with placenta previa, sometimes with bleeding issues during pregnancy, we will encourage them not to be as physically active, because that can actually aggravate the bleeding during the pregnancy. And with multiple gestation, sometimes twins and triplets, since there's a significant risk of preterm labor, if they're diagnosed with preterm labor already, then we will reduce their physical activity. Otherwise, I usually recommend at least 30 minutes, 6 out of 7 days in a week of exercise.
That low-lying placenta that you talked about, that's one of the contraindications that we talk to moms in our introduction to exercise class, to let them know what's safe and what's not safe. So having a low-lying placenta after the ultrasound that you do at about 26 weeks, we say after 26 weeks to talk to your doctor, and our exercise program isn't a good choice for them.
So Gail, when do you start? When are expectant mothers supposed to start the exercise program?
They can start whenever they want. If they want to
at
start
2 minutes pregnant, as soon as
2 minutes pregnant,
let's
go exercise. Most moms don't feel like it until really the second trimester, but we've had moms who have started, you know, at 8 to 10 weeks pregnant.
What about exercise? Do they go join a yoga class for 30 minutes? Is that what they do? You know, what's the prescription that you would prescribe for someone?
I usually recommend, or my prescription is 30 minutes of cardiovascular activity at least 6 out of 7 days a week. So walking, because a lot of these patients coming in have never exercised in their life. So walking at a moderate pace is cardiovascular activity, and 30 minutes or 15-minute intervals, if they can't do 30 minutes at a time, is sufficient.
I know during the exercise class, I just constantly am asking the moms, how are they feeling? Are they thirsty? Are they starting to get hot? Are they starting to get tired? Just to always check in with how they're feeling, because one mom who might be an elite athlete might be in the same class with the couch potato mom who maybe never did anything before. So everyone, that perceived level of exertion that Dr. Krishnan talked about earlier is exactly what we're talking about on a scale to 1 to 10. How do I feel? 1 is sitting on the couch changing the channels. 10, you're working so hard you feel like you're going to fall on the floor. We don't want you at either of those levels. We want you at about anywhere from 5 to 7. 7 is working moderately hard. So at like 75% of how you perceive.
Okay, so we've talked about cardio, work at a moderate rate, 30 minutes, rest at 15 if you feel like you're getting tired. What else? I mean, do we do weights? Do we go do dance? Do we go skiing? Do we go water skiing? Yeah.
So, you know, anything that's non-high impact. So, you know, turbo kickboxing would not be it. Zumba dancing probably would not be it. But anything that's not, especially after 24 weeks, you don't want any jerking motions to the abdomen. But, you know, and skiing, racquetball, tennis, those kind of sports are a little bit more contact sports. So after 20 weeks, the uterus is at the belly button or the umbilicus. And after 20 weeks is really growing up out of the abdomen. So if something were to come in contact with the uterus, there would be significant issues with the placenta. So we try to avoid those kind of traumatic sports.
And even in like the aerobic type classes that we do, we say no ballistic movements, and that's the bouncy movement. So no jumping, we keep one foot on the floor at all times. So we'll do like a step touch, but we always keep one foot on the floor.
So you can go dancing.
You can go dancing. Dancing's
Yeah.
awesome.
Okay, so we can go dancing, we can go swimming.
You can do yoga, you can walk, you can, you could ride a stationary bike. Probably last trimester, I'd probably say not out on the road.
Last trimester is a little difficult.
Yeah, but maybe first and second trimester, you could probably, if you're wearing a helmet and you're in a safe area, and you could probably continue to ride a bike if that's something that you like and enjoy doing.
Any weight training that you advise at all?
I wouldn't do heavy weightlifting. We don't want to cause the Valsalva maneuver, which is holding
bearing
your breath
down.
and bearing down. But light weights, 5-pound weights are great for strength training. We don't even use weights in our particular class, but we will use the stretchy bands, and so those are
that's
kind
a
of
good
nice.
idea.
So those do some resistance exercises, so we can do some triceps and biceps, because one of the things I know moms really notice postpartum is that their arms are killing them, because just a 7 or 8 pound baby, they're really
That's
lifting
right.
them,
That's
they're putting them
right.
in the car seat, they're changing those diapers, they're breastfeeding, and that really causes some pain afterwards. So we want them to be strong so they can do the work that mothers have to do.
Yeah, no, that's why I mention it, because it really, once that baby's born, they have to carry it around. The other thing is now with the new cribs coming out, you know, without no side rails, you can't lower the crib. So that means you are going to constantly be bending over to pick up that baby. So it's going to be really important that you strengthen your lower back. So what would be some good exercises for strengthening the lower back?
Pelvic tilts are one of our favorite exercises for pregnant people. That can be something that they use actually during labor. It can help with back pain, and it just helps to strengthen those muscles. Anything that works the abdomen. So we wouldn't do sit-ups, but we would have them tighten their bellies. Sometimes standing up and doing some of the Pilates moves. So rotating your foot in a circular motion, a couple feet off the ground, just but pulling in your belly at the same time helps to tone those abdominal muscles, and so strong abdominal muscles goes hand in hand with weak or bad back muscles. So we want to have a nice strong abdomen to help support our back.
What's your favorite exercise program for your patients?
I usually recommend, I work with a group that usually is not as physically fit, so I usually recommend walking. If the weather is not great, they'll walk inside of a mall or walk around Lake Elizabeth. Yoga is very popular. I think it helps with flexibility, it helps with pushing, but usually I'll recommend at least 5 or 6 days of cardio activity, and then if they can get in yoga on top of that, that would be great.
For some of the yoga classes, I think I was just thinking about the hot yoga. Of course, we wouldn't do that because of pregnancy, but also some positions in yoga we would want to avoid. So maybe in early pregnancy, the down dog position might increase that lightheadedness that mothers have. We don't want to do any inversion postures, so we wouldn't have their feet up in the air and up on the elbows.
The plow and
or
what's that snake one where you put you all the way over?
Yeah,
that would
might
be a
not
little hard.
That would be very hard. But
Yeah.
there are a lot of real safe exercise programs in
Tai
Washington.
Chi, I think, would be very good during pregnancy.
That would be awesome.
And for balance, right, yeah.
That would be perfect.
Yeah. Well, thank you very much. It's been really enlightening. Pregnancy is a time of significant change in the life of a woman and her family. Although many of the physical and emotional changes can be anticipated, some may come as a surprise. But all are likely normal and positive. We hope that the information you've been given here will help you through your extraordinary and wonderful experience. Thank you for watching. We'll see you next time on Voices in Health. For more information on the topics we've discussed here, visit websites like these. And of course, consult your physician. If you are pregnant, there is a great deal you can do to make sure that everything goes as it should and that you will have a happy, healthy baby.